More than 1/3 of Cambodians live below the poverty line, struggling to survive on less than $1 a day. Poverty is particularly widespread in rural areas and among children, who make up more than half the country's population. Cambodia also has the highest infant mortality rate in the region, with 1 death for every 10 live births. Richard Bridle, head of UNICEF Cambodia, was in the UK this week. I began by asking him to outline the situation facing children in the country.
Cambodia is the least developed country, so it's one of the poorest in the region. It has had very high economic growth over the past few years, GDP growth of around 10% per year, and that's allowed reductions of 1% per year in the overall poverty rate, bringing it down now to around 35%. All of that, of course, is under threat because of the global economic downturn, and the main drivers of GDP growth, which are the garment industry, tourism and construction, those have all seen a big downturn with a lot of unemployment coming up in urban areas. One of the impacts of that we've seen is that there has been a really large increase in acute malnutrition in under 5 children among the urban poor, a figure now around 16%. 15% is the cut-off for when you declare a nutritional emergency. If we look at Millennium Development Goals, generally things have been pretty much on track. The ones that really concern us are that the reductions in child mortality are not as steep as we would like to see them, so there's some unfinished business there. We're doing well on water supply, but still badly on sanitation. And then the big one for us is, if we look at maternal mortality, the figure has stayed the same since the year 2000. And that's an area where UNICEF Cambodia in 2009 has decided it is our single advocacy priority. We want to make a dent in that figure, not just so that we can reduce maternal deaths, which in itself is something that needs to be done, but if we do reduce maternal deaths, then we will also be attacking directly the major instance of child death, which is now deaths within the first month of life.
What are the causes of these deaths?
Well, you get a number of different causes. It can be birth asphyxia. There's still some tetanus, although we're well on the way to eliminating maternal and neonatal tetanus. There's also some infections that can occur, particularly respiratory infections, in that first period of life, plus nutritional causes, so making sure that we get very early onset of breastfeeding and real exclusive breastfeeding over the first 6 months. And actually there we have some very tangible results. We've seen the rate of exclusive breastfeeding has gone up from 12% to 60%, largely as a result of a community-based promotional campaign to women to breastfeed, which is even overcoming some of the traditional beliefs. We have some very promising results there.
What else is UNICEF doing in terms of maternal health?
We are, first of all, making sure that this is a government priority. It's not through UNICEF action alone that we can ever achieve any results. So we fortunately have the Prime Minister of Cambodia is talking this up. In a recent speech I saw, he said, if you get ill and you don't see a health worker, the likelihood is that you'll probably cure yourself. But if you're a woman who's giving birth, you need help. This has led the Minister of Health to make increasing the availability of trained midwives his top priority, and we're beginning to see the results of that in terms of the proportion of deliveries that are done in health centres or out of health centres by a trained midwife. The big hurdle now for us is to make sure that we can achieve universal free access to emergency obstetric care. Cost is the biggest barrier at the moment. It's a state health system, but it's a state health system that works on the basis of user fees. And we're very concerned that what's happening at the moment is that a lot of women are deciding to put themselves at risk to save money.
How has support from the UK helped your work in Cambodia?
Okay, well, there are two sources of support from the UK. One is that we have had direct contributions from the UK Committee for UNICEF. Those have mostly been in water sanitation, so they have helped us in increasing sanitation coverage through what we call community-led total sanitation. It's a scheme where the money gets spent on social mobilization, not on hardware. Families invest themselves in the hardware, and when we say hardware, it's a sort of thatch structure, hole in the ground, perfectly hygienic, but it's very, very low cost. And the advantage is that it gets used, it gets kept clean, and when it fills up, the families move it to another location. And that will also have an impact on mortality, because so much of mortality is due to insanitary conditions. The other contribution we've had from the UK Committee has been in the area of child protection, looking at children in contact with the law, training police, particularly the police anti-trafficking, and so on.
What are UNICEF's plans for the future in Cambodia?
It's kind of difficult to look at plans for the future because we are entering into a period of such uncertainty with the global economic downturn. The drivers of GDP growth are on their own downturn. We expect possibly to see quite a phenomenon of reverse migration. So people leaving livelihoods in the cities and going back to the countryside, which means that we're going to have to look at much greater adaptability in how local services are organised.
This is Andy Brown reporting for UNICEF UK.